各位傳媒朋友
Good morning, friends of the media. Thank you for attending to the 11 o'clock anti-epidemic press conference. Besides the Chief Executive, we have the Secretary for Civil Service and the Secretary for Food and Health. The Chief Executive and the Secretary for Civil Service will give their opening remarks, and then we'll open for the questions. Please wear your mask properly and keep your social distancing. Good morning, friends of the media and members of the public. Today is the first day of the Easter long holiday. Once again, I appeal to the public that while enjoying the holidays, they should observe the anti-epidemic measures, wearing masks properly, and when going out, they should wear the mask provided, the KF95 mask provided in the anti-epidemic service packs. Wash your hands properly, and hopefully we can all safely enjoy the Easter holidays and get ready for the 21st of April, the first set of adjustment. And for the students, from the 19th of April, they can gradually resume face-to-face classes in stages. On the 15th of April, today is the National Security Education Day. And the NBCSC Standing Committee have promulgated the national security law. One the requirement is that on the 15th of April every year will be designated as the National Security Education Day. This is the 7th Education Day. And I'm also the second National Security Education Day chair organized by myself and my committee. And due to epidemic measures, unlike the first Education Day, we cannot hold the physical activities. Last year activities include a large-scale commencement ceremony, a large-scale seminar, and school activities, and in the community participatory events, and the open day in various disciplinary forces. However, we attach equal importance of the second National Security Education Day. Therefore, the promotion activities will be conducted online. We produce a 5-minute special program to introduce the concepts of national security. The Civil Service College also provided online learning materials and children's storybooks, as well as materials produced in ethnic minority languages. The RTHK also produced special programs in this regard. I encourage everyone to visit the dedicated website. I would like to take this opportunity that on last year, on the commencement ceremony of the Education Day last year, and on the make a few undertakings as the chairperson of the NSL Commission. Well, we will take forward and safeguarding the Hong Kong national security to ensure a full understanding and across-the-board implementation of national security concepts as the encompass different aspects, for example, economic politics, technology, financials, and public health domains. And second, I promise to mobilize everyone in the community to enhance the public understanding of national security concept and sense of law-abidingness in order to safeguard national security as everyone's duty. The Education Day in terms of promotion has spent considerable effort. We have spread the message of national security extensively. For last year and this year, we've organized community exhibitions and public education campaigns, which we hope to spread the message of national security to campuses and the community, and the children can learn from young the concepts of national security. The third promise is to make the public service to play a bigger role in safeguarding national security. And over the 18 months, the government has introduced the oath-taking requirement and swear allegiance to the Special Administrative Region, and according to Article Basic Law, to take necessary measures to step up the supervision and the management of schools, organizations, and media and the online domains on the dealings with the national security. We have also set up the organ responsible for enforcing national security, for example, HKPF National Security Department and the NSL Prosecutor Division under the DOJ. I believe that three promises can make the HKSAR can consistently promote national security education. As I said, the national security encompasses many domains and not just limited to the understanding of the national security law and the implementation, and not just about territorial security and law and order. This holistic national security concept is all-encompassing and involves multiple domains. And the basic tenet will be the security of the citizens. Therefore, public health and the security of our public health as well as the safety of our pharmaceutical products is paramount. And over the past 2 years, we have not let down an effort to contain the epidemic. Vaccination is one way to ensure security. And also a key measure to protect our healthcare system. As we gradually relax our social distancing measures, the vaccine pass will be adopted even more widely. Therefore, we will need to take forward this line of work. And today we've arranged Secretary of the Civil Service to coordinate the vaccination drive in the territory to provide you on the latest update. Secretary, thank you, Chief Executive. Good afternoon, members of the public and the media. Today is the 5th time I shall report on the latest on the vaccination program. I would like to talk about the works in 2 areas. From next Tuesday on 19th of April, and we will start accepting registration for the home vaccination campaign. And about the vaccination progress for the residential homes for the elderly and those with disabilities. As of last night date, we have 15.59 million doses administered, and we have 6.3 million people who accepted 2 doses, as about 92.6% of the population are vaccinated. About 3 to 11 years old, over 335,000 people had the first doses. 63% of the age group. And for those 3 years old, both for those who vaccinated for the first dose, in a total, we have 6.57 million population, which is 90% of the total age group. And 5.81 million have accepted doses. About 86% of the population was vaccinated. And over 3 million accepted a 3 dose. And 3.02 million people. And for 60 to 69, the first dose vaccination rate is 90.7%. 7 to 79 age group, 82.8%. Age 80 or above, 60.5%. And for the second dose vaccination rate of these age groups are 60 to 69, 65.1%, 70 to 79, 75.1%, age 80 or above, 48.2%. So these are the vaccination rate for the first and second dose. Looking at those numbers, age 70 or above, about 700,000 of those have administered the first dose. The vaccination rate is 73.5%. And for those who have the second dose, the vaccination rate is 63.9%. We are pulling all stops to boost the elderly vaccination rate. To promote and facilitate elderly vaccination, we will expand the home vaccination scheme. And the previous report on the 30th of March, and for the buildings under the lockdown testing, we will provide a home vaccination for those age 70 or above. And for those who are mobility impaired, we will provide home vaccination of the Sinovac vaccines. As of 14th of April, in about 2 weeks, in the 13 buildings, we provided home vaccination to 50 individuals. 42 of those were 70 to 98 years old, and 4 were 14 to 65 years old, and who were chronically ill or mobility impaired, and 4 were living members of eligible individuals. After 4 weeks, we have rationalized the home vaccination arrangements. And besides the follow-up cases, we have received 100 registrations, including those registrations collected through community assistance. And the HKCSS and the Medical Association have also provided their own home vaccination scheme. They referred 9,000 outstanding cases for our handling. And next Tuesday, on 19th of April onwards, we will launch an online registration platform and an inquiry hotline to cover all 18 districts. So as you can see on the screen, so this is the website for registration and an inquiry hotline, 5688-5234. The hotline will operate from 9 a.m. to 8 p.m. daily. Therefore, I appeal to those who are over 70 and yet to be vaccinated, or could not go out to get vaccinated due to illness or mobility impaired, to get vaccinated as soon as possible. I also encourage their friends and families to conduct online or phone registration for them. The home vaccination visits will start on the 26th of April. That will last for 8 weeks. We will take a district-by-district approach, and each week we will target about 4 to 5 districts to conduct home vaccinations with 4 weeks per cycle to ensure all the eligible registrants can get vaccinated. After 28 days into the first dose, we will pay another visit for another Sinovac vaccine. Before vaccination, simple assessment will be conducted, and the registrant can make inquiries to the medical personnel visiting. And we are providing the Sinovac vaccine for the home vaccination as it is easier to arrange. For the common vaccine, their dilution procedures is a bit complicated. To facilitate more elderly to get vaccinated, our hotline center will not just wait for the public to call them, and we will actively seeking eligible individuals and to introduce them to the home vaccination scheme and encourage them to register. First, the Social Welfare Department have compiled a list of 200,000 individuals who are unvaccinated but on various cash assistance scheme. And from next week, they will send them pamphlets of the home vaccination scheme reminding them to register. The Social Welfare Department has appointed the hotline center to call the individuals on the list in order to help them with the registration. And the 18 elderly health centers and nurses under Department of Health will call 28,200 members who are yet to be vaccinated. And for the elderly health centers, about 84% of those were already received their first dose. So 16% of those are yet to be vaccinated. They will be contacted by phone to encourage them to get vaccinated in order to correct any misunderstanding about vaccines. And for those who receive a third dose, SMS will be issued to them to inform them of the expert recommendations that they can receive an extra dose 3 months after their third dose to enhance their protection. And thirdly, the patients helpline under the hospital authority will encourage the general outpatients and elderly individuals to explain the benefits of the vaccination, and if necessary, they will arrange vaccination at the vaccination stations or in other locations. And fourthly, on the May and April, during the lockdown testing operations, we'll continue to look for eligible individuals and those mobility impaired to arrange medical teams for home vaccinations. And for the RCHEs and the RCHDs, I have reported last week the second stage of the outreach vaccination campaign will be completed later today. At the second stage of the residential homes outreach, all the RCHEs and RCHDs, and for those who are suitable for vaccination, we'll arrange the outreach vaccination teams to visit them and provide them with the first or second or third dose. We have completed the second stage, and we shall commence on the third stage of vaccination.
In order to launch the next phase smoothly, I have talked to the representatives of SWD and other departments, and also the outreach service teams, as well as operators of RCHEs and RCHDs, where we met through an online conference. We appeal to them for their support and assistance. Through our efforts, the vaccination rate has gone up from 55% to 70% yesterday. For RCHDs, it's 67%. RCHDs is 81%. For those who have received 2 jabs, the vaccination rate is for RCHD 42% and 36% for RCHEs and 43% for RCHDs. Some residents have been infected and they have now recovered. So in the coming 3 weeks, and that is before the 10th of May, we would offer vaccination to those residents who had been infected and now recovered. And if they have not been vaccinated, they would be offered the first one. If they have received the first or second jabs, they will be offered a further step through our outreach service. And also, the CHP has recently updated the arrangements for vaccination of Sinovac vaccine. For those who have been infected, after their recovery, the gap between the recovery and the next step will be reduced to 28 days. For those who are only suitable for BioNTech vaccinations, we are also making arrangements to offer the vaccination service through our outreach teams. So we have been trying to provide vaccination to the elderly and the young, to protect our elderly people. The vaccination is the key. The outreach program is a result of the pooling together of resources from various sectors so that we can reach everyone in the community, and especially the high-risk groups. If they cannot really go out, leave their homes for vaccination purposes, they will be still getting the vaccines at home. Let's stand together and combat the epidemic. We leave no one out. Only by doing this can Hong Kong cope with the possible new wave of COVID, and then we can emerge from the epidemic and return to normal life. Okay, now we have a Q&A session. Please raise your hands. Tell us your organization, and then we'll give you the mic for the one at the front row. I'm from cable TV. In the past 2 months, We visited many pharmacies in Hong Kong, and we discovered that they sell the prescription drugs without the presence of a pharmacist. Would you agree that the Department of Health has not been doing a good job? Do we need to mandate the presence of a pharmacist all day long instead of 2/3 of the time? And on the 31st of January, you said that in respect of Mr. Hong Wei-man's party, you would review the need to take actions against Mr. Ao Gao-wang, the Director of Immigration, and other people. Although the other day you said that you are not in a position to disclose more details, but we're talking about government officials. If there's any disciplinary action or penalty imposed, we should be informed. I'll ask the Secretary for Food and Health to say something later. But as I've said, national security is important. Includes security in various domains, life and property, medication, and so on, so forth. As I said, the FEHD is the enforcement agency. It has completed the investigation, and various sanctions have been imposed. For example, the summons has been issued to the restaurant. We are now sub judice. It's now in the judicial process stage. And if the guests have not used the Leave Home Safe app or wear a mask, action will be taken. I have to say that apart from the officer who have resigned, there are other cases undergoing the disciplinary procedure. 2 officers have been warned by the Secretary for Civil Service or his supervising officer. Thank you for your question. Of course, supervising how medicines are dispensed is very important. So the Department of Health has been implementing the registration system and monitoring the prescription and dispensing of drugs. It's a legal requirement that a pharmacy can only sell prescribed drugs with the presence of a pharmacist. At one point, we would like to mandate the employment of a pharmacist in every pharmacy, but there was a shortage of pharmacists at the time. So we allowed a manning ratio of 2/3 of a pharmacist for every pharmacist. But these community pharmacies are playing an important role, especially in primary health care. It's important that people can have access to drugs in the community when primary health care is promoted. We've been monitoring the manpower requirement. As for the situation you described, the Department of Health will take action to enforce the law when it comes to the promotion of primary health and the development of community pharmacies. We would also take appropriate measures. The next, the one in white. I'm from now. Concerning the home vaccination program, how many elderly people would you like to help? And to what extent would it boost the vaccination rate for the elderly? What's your objective? And also, why do you just offer Sinovac? If these elderly people want BioNTech, would you also help them in some way? And also, is there a quota for home vaccination? Or would you meet every request that come your way? As for care homes, the vaccination rate is about 70%. So what can you do to boost the rate? And it's been said that some family members do not like these elderly people to get vaccinated. Have you seen any improvement in that regard? regarding home vaccination service. Well, online platform will be launched. Anyone who need this, that is those who are over the age of 70 and who haven't been vaccinated, or those who are disabled or who cannot leave home to get vaccinated, they can register through this hotline. We'll look at the demand, the need for our service, and also look at the distribution of their homes. And the outreach teams would go to the districts one by one and offer vaccination. We need to launch the registration platform first before we can understand the need. So wherever there is a demand, we will offer the service through our outreach teams. We have already got the information that through the lockdown and testing operations that there are people, or how many people in those buildings who will need the home vaccination service. And through previous operations, we have registered some people, and also there's the scheme run by the Hong Kong CSS, some 9,000 cases who have received the first jab, and the second will follow. So there's already a certain level of the demand, and we would arrange the service to meet it. As for the vaccine to be offered, we started with Sinovac because the arrangement will be simpler. Secondly, for the elderly, those who chose Sinovac is of a higher proportion. So we will offer other vaccines in response to demand, and also the districts where they reside. We started with Sinovac when we provide the same service to care homes. Some of them can only receive BioNTech vaccines, and so arrangements are being made. That's the arrangement we have got so far.
And for the residential homes, after the first and second phase, and I'm grateful for the cooperation from the residential homes as well as the medical personnel teams. And now the first stage vaccination rate from the 55% to 70% are present. This is quite a remarkable progress, and the vaccinations have been very smooth. At the next stage, let's say for the next 3 weeks, that before the 10th of May, they will pay another round of visits. By then, there'll be another batch of residents who were infected in around mid-March, and after a recovery, then that will be the right time to get vaccinated. Therefore, we can foresee that the vaccination rate will be further increased. Therefore, I'm not worried. And for the objections from family members of the residents, about 6% the residents' family members objected, while the residents themselves, when they can decide on themselves, about 3% objected. Altogether, it is about 9%. The SWD has issued letters to the residential homes by informing to the residents and their family members if the residents themselves cannot decide, if they have statutory guardians, if the guardians objected, they can make a written objections. If not, it would be based on the assessment of the medical personnel teams that they will vaccinate the suitable elderly and the residents. And our medical teams are proactively reaching out to the residents and their family members and once again explain to them and understand their concerns, and hope that they can be convinced and understand and agree to be vaccinated. This work will continue. I hope that we can take a multi-pronged approach, and while everyone can acknowledge the importance, so that more home residents can get vaccinated as soon as possible. Next question. On my right in the middle row.
The SCMP, how will you evaluate the effectiveness of the home vaccination program? The second question is, it was reported that some elderly nursing homes have experienced a second outbreak. What is the government doing to prevent it from further happening? The last one is, on the social distancing relaxation roadmap, after the announcement of the first phase relaxation, looking forward, what would be the criteria for the second phase relaxation, and what does the timeline look like? Thank you.
Well, I will address the last question and then invite the Secretary for Civil Service to talk about the effectiveness of the home vaccination program, and the Secretary for Food and Health to respond to your comment about the situation in our elderly homes. We announced yesterday the first phase relaxation of the social distancing measures, which will take place from the 21st of April. As I said yesterday, we will not be able to please everybody. So some listed premises under Cap 599F still have to be closed during the first phase. So certainly we will consider allowing them to resume business in the second or third phase. When will we decide and how will we decide? This is not an easy question because we have to closely monitor the epidemic situation, particularly in between the announcement and the actual implementation of a social distancing. We have this long Easter holiday. We should all remember what happened in the Chinese New Year holiday. We were very alert about the fifth wave. We imposed the very stringent social distancing measures from the 7th of January, well before the Chinese New Year. And we did manage to suppress that first outbreak in that fifth wave. But because of the Chinese New Year and a lot of cross-family interactions and dinners and gatherings, after the Chinese New Year, this wave hit us very hard. So we really have to monitor very closely what will happen after the Easter holiday. But let me assure those premises which have yet to have a chance to reopen for business, we will take into account their interests, because their interest is not just the corporation's interest, but also to bring Hong Kong back to normalcy, and also the jobs for their employees. So we will timely review the situation and try our very best to proceed according to what I announced on the 21st of March. That is, we have a second phase in a month's time and then a final third phase in another month's time. Patrick.
Yeah. As regards our home vaccination service, I think everyone would agree that it is a very time and labor-intensive operation. We need to do a lot of preparation work, and from the operational experience so far, the outreach healthcare team normally would be able to administer about 3 to 4 doses in an hour. So it really is very time and labor-intensive. But if we look at the necessity of getting particularly the vulnerable groups to get vaccinated, we have already, in the past year, provided multiple channels, convenient places to enable persons to get vaccinated, including at present 28 community vaccination centers, the 13 hospital vaccination stations in public hospitals, 4 mobile vaccination units, and more than 1,000 private clinics, and also the clinics under the Department of Health and Hospital Authority. We also undergoing the outreach vaccination service for residential care homes. For those elderly and persons with disabilities who wish to get vaccinated, but who are unable to go to these places, no matter how convenient they are, we have to serve them. And that's why we have to do this home vaccination service. And I'm grateful for all the healthcare teams and also all the other organizations and bodies and volunteers to join hands in doing this, including our medical and nursing students from the tertiary institutions who are going to help us in manning the hotline service starting from next Tuesday.
Secretary for Food and Health.
Yes. First of all, thank you for your question. Obviously, especially in the fifth wave, elderly is our priority group, and our priority setting is the residential homes for the elderly, so no doubt about it. I understand the Social Welfare Department is working very, very closely with all the residential homes for the elderly, together with the Center for Health Protection, the Hospital Authority, to improve the overall situation. So much so, the Permanent Secretary for Labor and Welfare is chairing a task force to oversee, all the different improvement measures, in the elderly homes for, in the homes for the elderly. As far as the outbreak is concerned, so a very close outbreak monitoring is going on. All the residents of the elderly homes as well as their staff is having a daily rapid antigen test. So when they tested positive, especially the residents, the residential homes would have to report to the Center for Health Protection so that we are monitoring any outbreak on a daily basis. Second, in terms of the overall situation now, the number of elderly residents in the elderly homes becoming positive, the numbers has been going down, but there are still some. So very close monitoring is in place, and they will be isolated immediately after the isolation order is issued. Then they will be, they have, obviously if the elderly situation would require hospitalization, they will be sent to the hospital. If their situation allows them to actually go to the holding center, the number of holding centers such as those at the Kai Tak cruise terminal, etc., the number of holding centers for the elderly, they will be sent there as well. So they would be effectively isolated. As far as the community geriatric assessment team by the hospital authority, they are also monitoring these residential homes very closely. And if there is a need for the antiviral drugs, they would be given these antiviral drugs immediately. So all the different parties are working very closely to monitor the residential homes for the elderly, the overall situation in terms of the number of infected cases, the risk of outbreak, as well as the use of drugs, and also the other overall monitoring and also caring for the elderly. Of course, the number of holding centers and also quarantine centers at the AWE and also in the different holding centers would allow the effective isolation and also quarantining of the elderly so that the risk of further outbreak would be reduced. Thank you.
好，下一位記者提問。前排嗰位男記者戴眼鏡嗰位。
The gentleman at the front. I'm from News. Today is a National Security Education Day. CE, what do you think the risks we are facing in terms of national security? And now the number of cases has dropped to under 1,000. How do you assess the current situation? And now we have the BA5 variant. What are we going to do to deal with this? If the number of confirmed cases continue to drop, are you going to stop doing this conference? And what about opening up with the mainland? Do you have a timetable? I will say something about the anti-epidemic efforts. We are assessing the situation of the epidemic on a daily basis. At 4:30 p.m. every day, you have the press briefing of the Center for Health and Protection. There are other indicators that we are monitoring. Let me inform you as follows. There was the the sewage sampling testing at designated area and also at some random locations. On the 13th of April, the sampling test it tells us that we are facing a declining trend of cases, a drop of some 80% compared with the 21st of March. At the designated locations, if we detect the viral count of the sample is high, we would do the lockdown and testing operations so as to find out the infections, the confirmed cases in those buildings. So, how many people can we? How many presumptive cases can we find during such operation? Would be one indicator to look for. The recent one on the 12th of April, and that is how many presumptive cases have been discovered out of a total number of those tested. The ratio is just 0.58%, a drop of 90% over previous levels. The third indicator is that we are now also resuming the issuing of compulsory testing order. So we have through the community testing centers, mobile testing centers, and Department of Health and HA facilities, the confirmation rate or positive case rate is 1.1%, which is encouraging because it's much lower than previously. And another two indicators of Hong Kong U, and that is the propagation rate. It's a 0.4856%, which is lower than what it was a few days ago. But I'm concerned that after the Easter holidays, and that is how many people would get infected by another patient would go up again. Another study is the snapshot incidence rate, or the time point positive rate. The rate is 0.15%. In mid-March, the percentage was in double digits. So apart from these indicators and also the number of positive cases as reported in the daily press briefings, they would inform us that things are steadily getting better. But we have to do more to prevent importation of cases. Starting from the 9th of March, we have been doing these press conferences almost on a daily basis. I already said that this will be suspended when the case number is lower than 1,000. So yesterday it was 1,043. Then maybe today we are going to get fewer than 1,000, and then today you'll not see me in this press conference. But I would still see you at the other press conferences, for example, the one before the Executive Council every Tuesday. But there will be no Executive Council meeting next Tuesday. And I would ask the Secretary to talk about, for Food and Health, to talk about the BA.5 variant. Prevention and importation of cases is an important measure, and we have no intention to relax the relevant measures. Although there is a lot of people asking for this to be done, there are people who would like to spare the hotel quarantine period after they have visited another country and returned to Hong Kong. But we have no intention to relax the measures to prevent the importation of cases from outside Hong Kong. On national security education, well, we need to go deep. In 1 or 2 years, we must allow the community and Hong Kong people to grasp the importance of doing this, the importance of national security. But objectively speaking, we have done a lot. We have security in territorial integrity, law and order, and so on and so forth. And this is the first time we have a piece of legislation on national security since the reunification. And the other one is political security. We have improved our electoral system to ensure that we have pages administering Hong Kong. And we don't have anyone who is not a patriot, and people who collude with external war forces and then become members of our different councils and jeopardize national security. There are 16 aspects of domains: territorial integrity, security, and other security matters. But for food, internet security and other aspects will need to be worked on. In my remaining term, I will continue to work hard on all these areas, and I will urge the next term government to continue to do this to ensure that we can fully safeguard the national security of not just Hong Kong ACL, but also of the entire country. The Secretary for Food and Health will talk about the new variant. BA.5 case, this was found in a person who came from South Africa, and it was found in a hotel guest. It shows that our measures to prevent importations is effective in identifying new variants. We have BA.1, BA.2, and now we have this BA.5. WHO is now assessing the overall situation and is monitoring whether the new variant would lead to higher transmissibility or serious cases among the infected. But so far, there's no evidence of that. We have talked to our experts. So for the time being, there's no need to worry. But we'll continue to monitor the situation. And we'll do the genome sequencing to give us a better picture of new variant and also how this would affect our risk levels. We have different measures, different barriers to prevent new variants from getting into our community. That's very important.
Next question in the back row. HK01. Just now, you mentioned that you may not hold this press conference tomorrow. So under the fifth wave, Hong Kong with over 1 million cases and over 9,000 fatalities with assistance from the central authorities. And how do you assess your performance in the fifth wave? And what were the shortcomings and what are the bright points? Well, there are currently about 1,000 daily cases at a rather high level, and now decide to relax various measures. We shifted from dynamic zero COVID policies to coexisting with COVID. And next question on vaccination. You said you will help the elderly get vaccinated. And for the primary school student from 3 to 11, the vaccination rate is over 90% and school will restart soon. And what incentive would you offer to the students? And why can't you make an announcement now? I'll let Secretary Nip to talk about the vaccination question. For the student vaccinations, the vaccination rate of first dose 3 to 11 is 63.6%. And for 12 to 17, the vaccination rate is over 90%. The second dose should be around 70%. While for the secondary students, they should catch up with their second dose. That shouldn't be a problem. For the 3 to 11 age group, we try to promote it through schools and provide multiple channels. For example, the community vaccination centers and the mobile vaccination vehicles, and organize vaccination days at schools. And the schools and the kindergartens are working together on this. While the schools are still in holiday, therefore this hampered our effort a little bit. With the school reopening, the EDB are maintaining close contacts with schools, and these outreach vaccination and the vaccination vehicles will visit the schools to help the student vaccinate. Therefore, this work is ongoing. And second, some of the students were infected earlier, and it's still not yet time for them to get vaccinations. So there's a certain percentage of students that wasn't included in the vaccination statistics. And thirdly, the health authorities and the Hong Kong College of Pediatricians are organizing online seminars and short clips to explain on the necessity and importance and the safety of children vaccinations. And there's a recent government API targeting students. This is a multi-pronged approach, and I'll continue to appeal to the parents to be aware of the importance of vaccination. They shouldn't wait for another outbreak to scramble for a vaccine. In the public health domain, containing the epidemic is about putting the public lives at the score. Another major objective is to protect the public health system from crumbling. As for each stage and how do we curb the pandemic will be subject to the actual circumstances. And we also need to monitor the characteristics of each variant, as well as our own capability and social acceptance. With about 1,000 cases a day, we cannot adopt the same attitude of the previous 4 waves. In the previous 4 waves, Hong Kong have been quite safe and regarded as quite success stories back then. And for the height of the wave, 3rd wave, our cases did not exceed 150 daily. Well, we need to get to this low number before we can adjust our strategy like social distancing measures. I don't think the public would accept this. We need to be flexible in adjusting our policies. And thirdly, in formulating pandemic strategies, besides considering the public health, we need to consider the actual needs of the economy and social acceptance. And what is the most effective way to achieve a maximum benefit at the lowest cost? This is not an easy feat, which need to continuously assess and make decisions. And third, social acceptance. Well, the culture and whether the peoples are willing to accept the restrictions out of public health concerns. I need to make a decision call, otherwise the society will not stabilize. While the daily 1,000 cases per day is not the same as the 150 cases per day in the previous waves, we need to adopt a fresh mindset, especially under 5th wave. The central authorities provide immense assistance to Hong Kong. Today we have enough facilities in hospitals, or the community isolations facilities are having spare capacity. Even though the vaccination rate is low in some groups, however, the overall is about 90%. Very soon we have a second dose rate of 90%. We now have a stronger network to provide support for home quarantinees. Therefore, with all these new capabilities, we cannot just stick with the old attitude in controlling the epidemic. This will make Hong Kong pay a very heavy price. So this is the current position. And since the fifth wave in January, my team and I and most civil servants are working tirelessly around the clock. I'm also grateful to every sector in the community that against the backdrop of the fifth wave, we're seeing in everyone an act in solidarity. Otherwise, some of our measures could not have been implemented. Well, I'm asking to assess the performance that we have put our minds together. Hopefully, we can stabilize the pandemic situation in order to get our lives back on track. And once again, this is the first day of the Easter break. We need to restrain ourselves and avoid unnecessary gatherings. If we must go out, wear our mask properly and maintain personal hygiene so that the relaxation will go smooth as planned. That's the end of the press conferences, and I'll see you next time.